Okay, guys, carry on talking about blood vessels. Our topic today is blood pressure. Let us try to put the main topics on blood pressure in one page, remembering that you can always download the PDF for this tutorial as well as taking a look at other tutorials on our blog on one topic one page.blogspot.com. Okay, let us talk about blood pressure. When you talk about blood pressure, you are thinking in the pressure that your blood makes on the blood vessels. Normally, you measure this pressure in millimeters of mercury, and normally the range should be between 120 and 130 for the systolic pressure, and between 70 and 85 millimeters of mercury for your diastolic pressure. Remembering that systolic pressure is related to the ventricular contraction, whereas the diastolic pressure is related to the ventricular relaxation. Okay, some some elements will have some effect in your blood pressure. What does affect your blood pressure? First, the cardiac output, the quantity of blood, the volume of blood flowing in each pump from your heart. The volume of blood flowing, circulating in your body will have some effect as well. The viscosity of the blood, normally related with the level of albumin in your blood. The resistance that your vessel walls provide over the blood flow as well. This resistance will depend on some elements. For example, the vessel diameter will have effect over the resistance of the blood of the vessel walls. The blood viscosity, again, the albumin will have effect as well. The length of the vessels will have effect on the resistance that your vessel walls will provide over the blood as well. Another element that affects the blood pressure is the elasticity of the artery, the capacity of contraction of constrict will have some effect as well. Okay, and how does your body control your blood pressure? Well, everything happens from the core cardiovascular center, which is located in your medulla oblongata, and the control center will regulate your heart rate, will regulate the contractibility of your vessels, and the vessel diameter as well, by increasing or decreasing the vasoconstriction. The control center receives inputs from your baroreceptors, which it monitors the pressure of your blood vessels, and receives inputs as well from the chemoreceptors, which are normally monitoring your level of CO2, level of oxygen, level of hydrogen as well, and providing the proper feedback. The feedback normally will try to regulate your blood pressure. If you need to increase your heart rate of contractibility, the control center will use the sympathetic impulses. And parasympathetic impulses will be used if it's necessary to decrease your heart rate in order to control your blood pressure. Another way to control your blood pressure is releasing or decreasing the quantity of hormones on your circulation. Normally, many hormones will have effect. The epinephrine and norepinephrine having effects on the sympathetic responses, for example. Okay, you have the antidiuretic hormone having effect on the viscosity, the volume of your blood as well, and the control center as well can make you increase your respiration level, your level of inflow and outflow of oxygen by influencing your respiration. Okay? Okay, guys, this is a quick review with some important points that you have to bear in mind about blood pressure. Okay? Thank you for watching. See you later.